Today we're going over 50 quick fundamentals of nursing facts that you should know before taking your exam. I'll pause briefly after each fact, but feel free to pause the video if you need more time to think about it. Let's get NCLEX ready. Statement 1. Psychiatric patients have the right to refuse treatment. Statement 2. Minors can give consent if he or she is married or emancipated. Statement 3. Court can deny parents treatment refusal if the minor is in critical condition. Statement 4. The order of the stages of grief is denial, anger, bargaining, depression, and acceptance. Statement 5. Living will is an example of an advance directive. Statement 6. Mammograms are an example of secondary prevention. Statement 7. The 5 stages of the nursing process are assessment, diagnosis, planning, implementation, and evaluation. Statement 8. Confidential information can be disclosed if the client is a violent threat to himself or others. Statement 9. De-identified health information is changing the client's real name for a case study, which does not violate HIPAA. Statement 10. Principle of autonomy is the right to refuse treatment, choose treatment, and make one's own decision. Statement 11. Immunization against infectious disease is an example of primary prevention. Statement 12. The Nurse Practice Act ensures safe and competent nursing practice for those who need nursing care under the state rules and regulations. Statement 13. Medical malpractice is the type of negligence which is a breach or violation of professional duty. Statement 14. Veracity is being truthful and not withholding information. Statement 15. Teenagers can consent to medical care and treatment involving pregnancy or STDs. Statement 16. The American Nurses Association Code is a guideline for nurses to follow protocol and policies while following ethical obligations. Statement 17. Nurses can be liable for any injuries that occur from charting errors. Statement 18. Examples of internal emergencies include fire and gas leaks. Statement 19. Patients that have infections caused by contact must be placed in a private room or with other roommates with the same infection. Gloves and gowns are put on prior to entering the room. Statement 20. The nurse cannot get consent when the client is under sedation. Statement 21. Stroke rehabilitation programs are examples of tertiary prevention. Tertiary prevention is the treatment of existing diseases. Statement 22. The Safe Medical Devices Act of 1990 requires the nurse to report any incident that caused serious injury or illness by machinery to the Food and Drug Administration and the company of the machine. Statement 23. The nurse does not require the client's permission before using restraints when the client is demonstrating a risk of harm to him or herself or to others. Statement 24. The nurse should call security if the situation becomes threatening and not wait until violence occurs. Statement 25. The client can still leave without signing the against medical advice form. Great job in completing the first 25 fundamentals of nursing quick facts. Want to see how powerful my digital flashcards can be for NCLEX prep? Grab your 160 free flashcards at cutynurses.com/start and experience the difference. While you're here, don't forget to hit the red subscribe button below to stay updated with all our latest insights and tips. Now, let's dive into the next 25 fundamentals of nursing quick facts. Statement 26. The power of attorney is the one who makes the decision for the client when the client is no longer able to. Statement 27. If abortion is against the nurse's belief, then the nurse does not have to be a part of the procedure. Statement 28. Democratic management encourages staff to be part of the decision-making process. Statement 29. The licensed practical nurse can provide care for the stable patients. Statement 30. Threat or fear of harm is assault. Statement 31. The hazard communication standard does require that employees are trained on how to use the product safely. Statement 32. To remember which infections require droplet precaution, think of the viral acronym, which is the amazing Spider-Man. S is for sepsis, scarlet fever, and streptococcal pharyngitis. P is for parvovirus B19, pneumonia, pertussis. I is for influenza. D is for diphtheria, pharyngeal. E is for epiglottitis. R is for rubella. M is for mumps, meningitis, mycoplasma, and meningeal pneumonia. AN is for adenovirus. Statement 33. Think of the viral acronym Mrs. Wee to help you remember infection that requires contact precaution. M is for multi-drug resistant organisms. R is for respiratory infection. S is for skin infection. W is for wound infection. E is for enteric, such as Clostridium difficile. E is for eye infections, such as conjunctivitis. Statement 34. Use the viral acronym MTV to remember what the airborne diseases are. M is for measles. T for tuberculosis. V for varicella, also known as chickenpox. Statement 35. A patient with an airborne disease should be placed in an airborne isolation room with negative pressure. Statement 36. The right to die law states that the client has the right to choose death if he or she is terminal. Statement 37. Joint Commission standards are the basis of an objective evaluation process that can help healthcare organizations measure, assess, and improve performance. Statement 38. The nurse should not use any frayed or broken cords and should not roll machinery over cords. Statement 39. Someone who is designated to make medical decisions when the client is no longer able to is the durable power of attorney. Statement 40. Medications and procedures performed with minimal to no pain to benefit the client's health are considered ordinary means. Statement 41. The 6 links of the chain of infection are the infectious agent, reservoir, portal of exit or exit route, mode of transmission, portal of entry, and susceptible host. Statement 42. Bioterrorism is a biological emergency caused by terrorists. An example would be spreading anthrax. Statement 43. In the emergency response plan, the priority is to remove people from danger and to contact the supervisor. Statement 44. An example of fidelity is the nurse keeping the promise not to disclose the client's illness to the client's family as requested by the client. Statement 45. Giving an injection without consent is an example of battery. Statement 46. During discharge planning, the client is taught how to provide self-care at home, what to expect, and when to notify the physician. Statement 47. The State's Department of Motor Vehicles must be informed by the physician about the client's epilepsy disorder. Statement 48. As an advocate, the nurse does not make decisions for the client. Statement 49. Teenagers are allowed to be part of the medical decision, but the parent or guardian must provide consent. Statement 50. Battery is touching an individual without consent in a harmful way. Fantastic work on mastering all 50 quick fundamentals of nursing facts. Make sure you're confident with these before taking your next Fundamentals of Nursing exam or the NCLEX. Need more Fundamentals of Nursing practice? Check out my video, Fundamentals of Nursing Mastery, Ace the Fundamentals Alternate Format section on the NCLEX. Want more tips and tricks to become an exceptional nurse? Don't miss my next video where we explore essential nursing school hacks to boost your skills and success. Thanks for dropping in and see you in the next video.